Hello guys, welcome back to my channel, which is a real homeopathy channel. So I upload weekly 3 videos about the gynecology recently. Please do like, share and subscribe to my channel. Stay tuned for further uploads. Today we will be learning about the puberty, which is asked for 5 marks, 3 marks, which is a must know question in gynecology. I will be saying about the normal and abnormal characters or features of the puberty. So today we will be dealing with the puberty, which is the normal definition of the puberty, and this question will be even asked for 10 marks, which is the total the puberty, and there are certain divisions which you need to write about the puberty and common disorders of puberty. They will be asking about the precocious puberty and delayed puberty. They will be asking this in total. So let's come to the definition of puberty in girls. It is the period which links the childhood to the adulthood. So this is the linking. So it is a period of gradual development of the secondary sexual characters. So it is the gradual development. So you will see all the sexual characters which are being developed in a girl. So let's check about the morphological changes that happens once they attain a puberty. So there are breast changes that takes place there. Firstly, breast changes, and secondly we will see there is a pubic and axillary hair growth. Tertiarily we will see there is growth in height. We will see growth in height, and finally we will see there will be menstruation. These are the changes. These are the 5 changes: breast changes, pubic, axillary hair growth, height and menstruation. These are the 5 changes that we commonly see when they attain a puberty. We will see certain words which are like thelarchy and adenarchy and menarche. Thelarchy means there is a breast budding here. Thelarchy, attaining the breast budding. Then coming to adenarchy, adenarchy means there is a pubic and axillary hair growth. It is known as adenarchy. Next, coming to the menstruation, we will see it is a menarche. Menarche where the person attains a menstruation stage. Next, coming to the endocrinology in puberty that happens there, the endocrinological changes. Okay, we will see there are hypothalamo pituitary gonadal axis. So in that we will see there is a thyroid gland that plays a very important role. There are certain changes that takes place in the thyroid gland. So it plays an active role in hypothalamo pituitary gonadal axis. Okay, the GnRH pulses from hypothalamus results in pulsatile gonadotropin secretion, first during the night and then by the daytime. Nextly, there is a adrenal glands. So there are certain changes that takes place in the adrenal glands, which is a adenarchy. There is a increase their activity of the sex steroid synthesis. Next, coming to the tertiary, which is a gonadarchy, where there is an increased amplitude and frequency of GnRH. Okay, there is increase in the frequency of GnRH, and also furtherly there is increase in the secretion of FSH, follicle stimulating hormone, and LH, which is a luteinizing hormone. And we see ovarian follicular development begins when the person attains the puberty, and there will be increase in the estrogen levels. So gonadal estrogen is responsible for development of uterus here, vagina, vulva and also the breast. Okay, development of uterus, vagina, vulva and also the breast. Next, there is a fourthly we see there is a leptin, which is a peptide which is secreted in adipose tissue. It is also involved in pubertal changes and also in the menarche. Nextly, we will see common disorders which are there in the puberty. So, the certain common disorders of puberty we see there is a precocious puberty, delayed puberty, okay, menstrual abnormalities like amenorrhea, menorrhagia, and dysmenorrhea. Amenorrhea we see there is a absence of menses, and metrorrhagia where there is a heavy bleeding, and dysmenorrhea we see it is a painful menses, and others like infection, neoplasm, hirsutism, etc. So these are four: precocious puberty, delayed puberty, menstrual abnormalities, and others. Okay, like infection, neoplasm, and hirsutism, etc. Today we will be dealing about the precocious puberty. So precocious puberty, usually they'll be asking for 5 marks or 3 marks, which is a must know question for third year. So the definition of this is, so the term precocious puberty, it is reserved for girls who exhibit any secondary sex characters before the age of 6, before the age of 8, sorry. So before the age of 8, if a girl gets any features which I have said, which is a normal thing which I have said, if that all of the features happens between the age of 8, so it is called precocious puberty. Okay, so sorry for that delay there. So the term precocious puberty, it is reserved for girls. Okay, I'm sorry for that. So before age 7 in whites, okay, or menstruate before the age of 10. So if a girl menstruate before the age of 10, so it is called as a precocious puberty. Precocious puberty may be isosexual. So isosexual where the features are due to excess production of estrogen. Okay, isosexual which is due to the excess production of estrogen. It may be heterosexual also. Okay, heterosexual where features are due to excess production of androgen. So in isosexual we see it is due to excess production of estrogen, and in heterosexual we see it is due to excess production of androgen, which is from ovary and adrenal neoplasm. Only in those disorders you will see the cases of excessive production of androgen here. Okay, so there are two things that happens: isosexual and heterosexual. Is coming to the causes of this precocious puberty. So types or causes we will see mainly. So in every question you have to first write the definition, and secondly you have to come for the etiology, which is the cause, and if there are any types you have to write that, and also ethiopathology and treatment, its diagnosis and its management. So we see in the causes, we see firstly there is GnRH dependent, and that is the first type, GnRH dependent, and secondly we see GnRH independent. So in GnRH dependent, it is completely seen like in about 80% of the patients, many of these causes are being seen. So it is also known as complete or true. GnRH independent, it is like a precocious puberty of peripheral origin, so which is of excess estrogen or androgen maybe. Okay, so here GnRH dependent it is central, GnRH independent it is peripheral cause. So first in GnRH dependent we will see there is a, it is also known as true central, it is known as true central isosexual. So GnRH dependent is isosexual, GnRH independent is heterosexual. Okay, so in that, firstly we will see constitutional. So constitutional means which is the most commonest cause of this precocious puberty here. And secondly, we will see about the juvenile primary hypothyroidism. Okay, and thirdly, we will see about the CNS lesions, where the person gets it more commonly for 30%, like tumors and trauma, infections such as like tuberculosis and encephalitis. So the infection we see two types: tuberculosis and encephalitis. So these are the CNS lesions that we see basically, like trauma, tumor, and infections. So next, coming to the incomplete one. So in incomplete one, you will see premature thelarchy, which is a breast budding, and premature pubarchy. Okay, and finally we see there is a premature menarche, premature thelarchy, premature pubarchy, and finally premature menarche, attaining before the age of 8 in every of these cases. Okay, next we will be seeing about the GnRH independent here. GnRH independent, which is also of a precocious puberty, it is also known as it's of a peripheral origin, which is due to excess estrogen or androgen secretion, which is of a heterosexual. So here we see firstly there is a ovarian cause, adrenal cause, liver, and iatrogenic. Okay, the first we will see about the ovary now. So these are the tumorous lesions that we have that happens, and in that thing any tumoral causes are there, then the person may attain the precocious or puberty here. So the ovarian causes like granulosa cell tumor and secondly theca cell tumor. Then tertiarily we see there is a Leydig cell tumor and chorionic epithelioma, and we will see about the next one, which is androblastoma. Okay, and next coming to the adrenal cause, which is a hyperplasia here, hyperplasia. And yeah, these in the ovary you will see all of these which are the cancerous lesions. Okay, all of these are cancerous, which are tuberous lesions. Here in adrenal you will see hyperplasia again, which is like increases the number of these cells, hyperplasia. And next we will see the tumor. Okay, in liver also, which is of a same exact cause, which is a hepatoblastoma. Okay, hepatoblastoma. Next will be like iatrogenic cause. It is also like a estrogen or androgen intake. So these are the causes which you see. There is GnRH dependent and GnRH independent causes. GnRH dependent, which is peripheral origin, and GnRH dependent is central origin, and these are the causes you can write. Next, coming to the ethiopathology. Okay, ethiopathology is also very essential. You should write, and I'll be explaining it in brief for you all. So ethiopathology, there are constitutional lesions here. Constitutional lesions, it is due to premature activation of the hypothalamo pituitary ovarian axis. So constitutional, I have said you in general it's dependent, which is like a complete or central origin. So in that central origin I'll be saying what is the constitutional cause which happens there. So this is due to the premature activation of this hypothalamo pituitary ovarian axis. And next there is the intracranial lesions, and in intracranial lesions, which is meningitis, encephalitis, craniopharyngioma, neurofibroma, or any other tumor, or hypothalamic or pineal gland का any कुछ ट्यूमर है, तो then this intracranial lesions में कुछ lesions है, तो फिर the person will be definitely suffering from the precocious puberty. Next, coming to premature thelarchy, premature puberty, and premature menarche. Premature thelarchy, it is the isolated development of breast tissue before the age of 8, and commonly between 2 and 4 years of age. So either one or two of the breast may be enlarged. So there is no other feature of precocious puberty. Next, coming to the premature pubarchy, which is isolated development of axillary and or pubic hair, which is prior to the age of 8, without other signs of the precocious puberty. Okay, it is due to unusual sensitivity of end organs to the usual low level of hormones in the blood during childhood. Next, coming to the premature menarche, which is a menstruation. It is an isolated event of cyclic vaginal bleeding without any other signs of secondary development, sexual development नहीं है, but there is a menstruation. So this is a premature menarche. The cause remains unclear here, and it is related to unusual endocrine sensitivity of this endometrium to low levels of estrogen. Okay, and this was the end of the precocious puberty here. Nextly, I'll be saying about the delayed puberty, and it is also the must know question for 3 marks, 5 marks. So, I'll be saying about the definition now. So, puberty is said to be delayed. So, when the breast tissue or pubic hair or menstruation appears to be after 16 years. So, this is delayed in the puberty. So, that is not normal. That was precocious was before the age of 8, and delayed is it is after the age of 16. So, the normal upper age limit of menarche is 15. It is more common in boys than in girls, but 16 years it is a delayed only. The causes of this delayed puberty. You see, there are three main causes, three main headings here. Like, first one is hypergonadotropic hypogonadism. Hypergonado. So, in that first we will see subsection, we see gonadal dysgenesis. Gonadal dysgenesis, it is 45XO. And nextly we will see pure gonadal dysgenesis, which is 46XX and 46XY. There are 46XX chromosomes, and here 46XY chromosomes are pure gonadal dysgenesis. And tertiary we will be seeing there is ovarian failure, where there is a 46XX chromosomes. And next main heading is hypogonadotropic hypogonadism. So the first one was hypergonadotropic, and the second one is hypogonadotropic hypogonadism. So here you will see about the constitutional delay. So constitutional delay, as you've already known, I have explained it in the previous question. And second one is the chronic illness. Second one, the first one was the constitutional delay, okay, and the second one is chronic illness, like there is a malnutrition, okay. Tertiary, you see there is primary hypothyroidism. Tertiary, you will be saying primary hypothyroidism. Primary hypothyroidism. And fourth one is isolated gonadotropin deficiency, which it is also known as Kallmann's syndrome. Isolated gonadotropin deficiency, it is also known as Kallmann syndrome here. And final, which is the fifth one, it is about the intracranial lesions. So the last one will be about the intracranial lesions, which is of the cranial lesions here, which are of the tumors. And cranial lesions, you see there are certain tumors, so due to that you see this delayed puberty. So in that tumors you will be seeing about the craniopharyngioma, pituitary adenomas. Tertiary we will see eugonadism. So eugonadism, you see there are anatomical causes, okay, which is Mullerian agenesis, and you will see there is a imperforate hymen, okay, imperforate hymen. And third one, you will see there is a transverse vaginal septum. So this is a eugonadism, and will be this is the cause of this delayed puberty, okay. Next, first was the anatomical cause here. In anatomical cause, you'll be seeing Mullerian agenesis, imperforate hymen, transverse vaginal septum. That was anatomical cause. Next, you'll be seeing the androgen insensitivity syndrome, okay. Androgen insensitivity syndrome. Kindly do share. Thank you for watching. Kindly like, share, and subscribe to my channel, okay. Okay, bye.